Chapter 6, Part 2. We left off talking about the laboratory tests for the skeletal system. So it's really essential when we look at the complete blood count. We want to see how much red blood cells the body is producing. That gives us a lot of indication if the patient's forming enough red blood cells, sufficient enough to maintain the iron balance in the body as well. Muscular system, types of muscles. There's the skeletal, or the voluntary muscles. They're attached to bones. There's the visceral, or non-striated, or smooth involuntary lining walls of the internal structures such as veins and arteries, and the cardiac, which is involuntary, which is present in the heart. The muscular system is responsible for movement, maintaining posture, producing heat, and glycogen is stored in glucose in the muscles as well. Disorders of the muscular system include muscular dystrophy, multiple sclerosis, ALS, muscle cramps and tendinitis, muscular atrophy due to inactivity, viral infections such as poliomyelitis, and most of these also affect the nervous system. Please be aware that patients with muscular dystrophy, MS, or ALS might have difficulty keeping their arm in a position that is appropriate for phlebotomy and might need assistance. Laboratory tests for the muscular system, so we could do muscle enzymes such as heart enzymes, analysis of autoimmune antibodies, the ANA or anti-nuclear antibody, microscopic examination or culturing of the biopsy or tissue. The nervous system, neurons, specialized nerve cells, the brain, spinal cord, brain and spinal cord coverings and meninges, and the cerebral spinal fluid. Communication is sensation, thoughts, emotions, and memories. Sensory neurons, they transmit nerve impulses to the spinal cord or the brain from muscle tissues, and motor neurons transmit impulses to muscles from the spinal cord or the brain. So the central nervous system is made up of the brain and spinal cord, where the peripheral nervous system is everything outside the brain and spinal cord. The brain, along with the cranial nerves, function in all mental processes and many essential motor, sensory, and vascular responses. Spinal cord and spinal nerves control sensory, touch, motor, voluntary movements, and reflex or knee-jerk functions. And I apologize, that slide's not showing up, so we will go here. Psychology is the science of the mind, mental states, and processes, where the medical diagnosis and treatment, mental and or behavioral disorders is psychiatry. Psychiatry, sorry, I apologize. I'm got a dry patch here, sorry. Disorders of the nervous system, infectious conditions, encephalitis, meningitis, poliomyelitis, herpes, and post-polio syndrome. A stroke is the leading cause of paralysis. ALS, MS, Parkinson's disease, Bell's palsy, and cerebral palsy. These disorders impact the nervous system, which therefore change the patient's physical disposition. So in cases with patients with Parkinson's, they might have a tremor, so we have to find a way to stabilize their arm appropriately to provide a safe blood draw. There's epilepsy, hydrocephaly, spinal cord injuries, paralysis or partial paralysis, and physiological disorders. Please be aware of those that have epilepsy. If they are experiencing a seizure, we will then discontinue our blood draw and make sure the patient is safe and there is nothing nearby that could potentially harm them, and we will not place anything in their mouth. Figure 620 goes over the detailed structures of the spinal cord, as well as the components of the spinal column. Figure 621 talks about different types of paralysis and the location. Laboratory tests for the nervous system. Chemical analysis can reveal drug interactions as well as hormonal, protein, and enzyme alterations. Infections detected by bacterial, viral, or fungal cultures, or by the presence or specific antibodies or proteins. And therapeutic drug monitoring. Mood stabilizers such as lithium and antidepressants. These therapeutic drugs we will talk about later inside Chapter 16 and Chapter 15 are essential that we monitor these very closely. These will be time tests to make sure that the medication the patient on is working effectively. Respiratory system. Respiration allows for exchange of gases between the blood and air. When gases oxygen, O2, and carbon dioxide enter the blood, the circulatory system transports them between the lungs and tissues. Together, respiratory and circulatory systems carry O2 to the cells and remove CO2 from the tissue cells. And we're going to go into this in more detail in Chapter 7. The respiratory system. The nose is the primary filter for air entering the body. The pharynx is a tube-like passage for food and air. And the trachea, larynx, and bronchi are passages for outside air to reach the lungs. The larynx has vocal cords. There are 2 lungs. Right lung has 3 lobes, the left lung has 2, and allows for space for the heart. Red blood cells transport oxygen and CO2 via hemoglobin. Infections of the respiratory system include tuberculosis, multi-drug resistant TB, laryngitis, bronchitis, colds, sore throat, whooping cough, and tonsillitis. Being aware of the breakdown of these medical terms, itis being inflammation, and then we have our root term, which would describe the system or body organ that it is affecting. Rhinitis, which is the common cold, coughs, pneumonia, Legionella's disease, pleurisy, respiratory distress syndrome, respiratory syncytial virus, and influenza. Disorders of the respiratory system include conditions such as asthma, emphysema, and cystic fibrosis, and tumors. There are some examples here of normal bronchi and constricted, as well as lungs that have emphysema versus the normal appearance. So laboratory tests for the respiratory system include blood gases and blood pH, chemical constituents such as sodium chloride, bicarbonate, and potassium. We could do biopsies, throat swabs, sputum cultures, and bronchial washes can be examined microscopically or cultured for pathogenic microorganisms. We will be covering this in more detail inside Chapter 16 and 15. Digestive system. This breaks down the food chemically and physically into nutrients. Peristalsis is wave-like contraction of food through the intestine and eliminates waste products of digestion. The digestive system is a gastrointestinal tract made up of the mouth and teeth, pharynx, the stomach, intestines, small and large, the vital accessory organs such as saliva glands, liver, gallbladder, pancreas, and appendix, and the esophagus. Disorders of the digestive system include dental caries and periodontal disease, stomach disorders such as GERD, hiatal hernias. This is the protrusion through the diaphragm, irritable bowel syndrome, vomiting, H. pylori, and peptic ulcer disease. We will be covering H. pylori as a lab in our class. This is caused by a bacteria that's present in the gut that could cause stomach ulcers or stomach cancers. Intestinal disorders, we could have polyps, maldigestion, malabsorption, cancers, and appendicitis. Some more intestinal disorders include constipation, diarrhea, dysentery, and hemorrhoids, and pancreatitis. Disorders of the digestive system. Hepatitis is causes liver inflammation. There could be gallstones. The liver inflammation, the main cause of this is excessive alcohol consumption or viral hepatitis. Bacterial or parasitic infections, staphylococcal food poisoning, or this is also referred to as hepatitis A, H. pylori, typhoid fever, cholera, are just some of the disorders caused by bacterial or parasitic infections. There's also tapeworms, pinworms, hookworms, and roundworms. We do diagnose parasites and ovas inside our lab, and this will be covered again inside Chapter 16. We could do tissue biopsies, occult blood tests, tests for blood in the feces, bacterial cultures, analysis for ova and parasites, gastric analysis, and analysis of blood specimens. Again, we're going to cover these in more detail inside Chapter 15 and 16. The urinary system is made up of 2 kidneys, 2 ureters, the bladder, and the urethra. It produces and eliminates urine, regulates the amount of water and electrolytes, sodium, potassium chloride, calcium phosphate, and magnesium. It excretes nitrogenous waste products such as urea from the protein metabolism. The normal ratio of acid to base is 1:20. Blood pH and blood gas determinations provide information about the acid-base balance in the body. A normal blood pH is 7.35 to 7.45. This is just the anatomical figure of the inside of a kidney. Acidosis is blood pH less than 7.35, and alkalosis is blood pH more than 7.45. Nephrotic syndrome, cancers, diabetes, renal vein thrombosis, pericarditis, malaria, syphilis, bee stings, and transplant rejection are some disorders found in the urinary system. Acute or chronic kidney disease, glomerular nephritis, and end-stage renal disease, or ESRD. Some common tests is urine dipstick. We can evaluate the patient's urine using the urine dipstick, evaluation of blood specimens, osmolarity, GFR, and chemical constitutes. Urine dipstick is really crucial in our patients who come into the ER or present with altered mental status, as this gives us an idea of what's going on with the patient via their electrolytes. Are they dehydrated? What's their pH? Also, is there blood or white blood cells present? So we could do the chemical analysis, which includes albumin, ammonia, creatinine, total protein, BUN, uric acid, blood pH, blood gases, and electrolytes in the blood. Creatinine clearance evaluates the degree to which the kidneys are filtering out waste, and we commonly do this test if we think there is a dysfunction with the kidneys. The endocrine system. Endocrine glands secrete fluids, sweat, saliva, mucus, and digestive juices. The ductless glands, hormones go directly into the bloodstream, are the hypothalamus, pituitary, thyroid, and parathyroid, thymus, adrenal glands, ovaries, and testes. Disorders of the endocrine system. Many are inherited hormonal disorders: Addison's disease, Graves' disease, Hashimoto's thyroiditis, Cushing's syndrome, dwarfism, acromegaly, and giantism. I apologize, that slide's not wanting to show up. Some further disorders would be diabetes insipidus and mellitus, subacute thyroiditis, trophoblastic tumors, hypo and hyperthyroidism, neonatal hypothyroidism, hyperinsulinemia, hypoglycemia, which is low blood sugar, where hyperinsulinemia is the overproduction, and goiters, which is caused sometimes by a deficiency in the thyroid hormones. Laboratory tests for the endocrine system. Chemical analysis for all types of constituents regulated by the endocrine system include glucose, insulin, renin, serotonin, erythropoietin, and cortisol, and specific thyroid function tests. It is essential that we check these when patients complain of certain symptoms. The physician will further investigate to see the functioning of the endocrine system to provide an accurate treatment and diagnosis. This concludes Chapter 6, Part 2, Please view Chapter 6, Part 3 to continue this PowerPoint presentation.